Thank you, Samya. Hello, everyone. So, I'm Ayousha, and I'm here to present a topic called as frequency of uremic pruritus in end-stage renal disease patient. End-stage renal disease, it's a very, very common disease in our country these days because of the lack of early diagnosis and treatment and non-availability of the facilities. These patients with end-stage renal disease who needs treatment in terms of hemodialysis or renal transplant goes through multiple adverse effects of their uremic environment in the blood. One of such environment is the symptom of such environment is the uremic pruritus. Pruritus, as we all know, is an unpleasant sensation, unpleasant desire to scratch your body. So we call it uremic pruritus because the reason for this itch in the end-stage renal disease patient is uremia itself. And in uremia, we consider various parameters. However, I will only discuss the frequency of uremic pruritus. Uremic pruritus can adversely affect the patient in terms of poor quality of life because they have to itch their body all the time. Increasing depression itself because of the poor skin texture, lack of sleep, and it is said to be a predictor of mortality in these patients. So the objective of our study was to determine the burden of uremic pruritus in end-stage renal disease patient, those who are adequately dialyzed, which is thrice a week, maintenance hemodialysis, 4 hours each. So it was a cross-sectional study. The sample size was 65 and it was done in the hemodialysis unit of Sir Gangaram Hospital, Lahore during my training days. And its span was over 6 months from November 2017 to 2018. A questionnaire was designed where the patient's biodata and the various comorbid conditions were entered in terms of diabetes, hypertension, smoking status, and presence of uremic pruritus was recorded accordingly. SPSS was used, chi-square-T test was applied to see the effect of these variables on the uremic pruritus. P-value was less than 0.05 was considered significant for this. Our results show that frequency of uremic pruritus was 23.1%, which is quite significant in the patients who are adequately dialyzed. However, then we saw the effects of the other parameters. However, we could not find any significant relation between the pruritus and the rest of the parameters in terms of diabetes, hypertension, duration of maintenance hemodialysis, gender. Unlike the previous studies, where there were two studies, one was DOPS and one was in the Pakistan, and I don't remember the name of that study. Both of them shows a very high burden of the uremic pruritus, 70% in the Pakistani studies and 41% in the international study. However, in our study, it was only 23.1%. Moreover, in these studies, diabetes, hypertension, duration of hemodialysis, and the gender all had effect on the occurrence of uremic pruritus. The reason that in our study, these variables were not significant was the limitation of small sample size, which was only 65. However, in the other studies, the sample size was in hundreds and thousands. So, our conclusion is that still in the adequately hemodialyzed patient, the frequency of uremic pruritus is very high, which is 23.1%. And the purpose of this study is to come up with further study, the extension studies, which we will look into the causes of these uremic pruritus and how we can address all these uremic pruritus patients. And we have few other studies coming in the line to complete our study. That's all. If there is any question. So this is the last slide is acknowledgement to my supervisor, Professor Dr. Shahid Anwar at Gangaram Hospital, because this was my first study and I call it as a baby study because I have no idea of SPSS or anything at that time, but he guided us and now I have 4 or 5 studies after that. Thank you.